parents! This is one of the interactive PowerPoints for adjusting to college. In this one, we will cover homesickness. To use the interactive features of this PowerPoint, please sign up on the website by going to polev.com/Rachel McNam 603. Rachel is spelled R-A-C-H-A-E-L, or text Rachel McNam 603, RACHAELMCNAM 603 to 37607. Please use the arrow key to advance the slides. What should you expect emotionally from your student over the first semester? The truth is, right now, students are usually really excited to come to school. But mixed with that excitement are layers of other emotions, like worry over the college being a good fit, living with another person in a small space, and how college will be changed because of the coronavirus. Often this anxiety or fear will be shown as irritability and frustration with, you got it, parents, or really people they feel the most secure with. You can expect most students to experience every emotion on this feeling chart through this semester. The next slide will have our first poll. Please read the question and enter your response on the website described or when prompted by text. To be honest, during the summer and orientation, we often see students approaching college and the move towards independence like a bowl of Lucky Charms with only the marshmallows. But what do you think students are feeling in September? The next slide gives you an opportunity to respond. If you guessed feeling a little less excited, then you're right. Some degree of homesickness will affect over 60% of students. Homesickness is usually characterized by missing home, family, and friends, thinking about memories from home, and this can look like feelings of insecurity about college, feeling emotionally raw, having a hard time focusing on the good, new, and fun things going on at college, resulting in a relatively pessimistic view about college in general. Homesickness really makes sense. As you can see from the poll options, college students are experiencing more than homesickness. Attending college is really a major life change. It is possibly the biggest life change an individual will ever make. Almost every single thing has changed, so an emotional reaction should be expected. Most of the students' reactions to homesickness will pass. You will see that it starts to decrease after 6 weeks for most students. This is where the sage advice of finishing out a semester or a year comes from. How can we help as parents? Might be what most of you are thinking. Expected means normal, but that doesn't mean that parents aren't integral to helping their students manage their expectations and adjust to college. The first job is listening. Listening is a powerful intervention, and having people take the time to just let another talk without trying to guide the conversation is a true gift. As parents, this can be a challenge. We are used to solving children's experiences from their early baby and toddler days. But as children move into adulthood, parents are navigating a transition as well. The transition from parent to wise adult to new adult. Listening connotes respect and often allows adults to work through their experience and find their own solutions. It is normal as a parent to want to help your student feel better and even to solve their problems for them. But sometimes when we jump into doing that, we inadvertently make the person feel like their feelings are wrong or that we cannot fully understand their experience. It is important to acknowledge their feelings and how normal they are. Working through homesickness is a process, and research shows that working through it helps people build their skills for challenging situations in the future. Adapting to major life changes is often challenging, and it is important to have patience as a parent, and also to encourage your student to have patience with themselves. Here are a few different ways to validate. Try identifying the emotion your student is experiencing. Like, going to college was something you really looked forward to, and now it's harder, and you seem disappointed and sad because you are missing your friends, pets, and homes. You could also acknowledge their experience makes sense. I definitely get why you feel out of place and that you wish you went to the same college as Jay. You've gone to school together for years, and it must be weird to not be in the same place. Or normalizing their feelings and experiences. I know it seems like you're all alone with this, but I read the other day that more than 50% of students experience homesickness when adjusting to college. I tend to be wordy, but these can really be any length. For example, I can tell you're really struggling. Or, it is normal to be stressed and sad. Let's use a homesickness example for the next interactive component. It is a Friday night, 1 month into freshman year, and you get a phone call. Your student is crying and thinks they made a bad decision to go to college. You listen first. As emotional conversations go, it starts somewhat irrationally with statements like, "I can't go to college here. Everyone else fits in perfectly. It was the worst decision to come here." These types of comments are really hard to hear, especially for parents. However, most emotional conversations tend to start with more extreme thoughts and reactions. As a person talks it through, the process of talking helps the mind open the door to feeling calmer. As you listen, your student talks about missing their friends, a class that is really hard, and hating sitting alone in the dining hall. The process of listening and validating allows emotions to be acknowledged, experiences to be discussed, and the more analytical parts of the mind to become engaged. You may notice that the conversation has moved away from straight venting. Your student could start to make tentative plans about what to do, or make statements like, "Maybe I could try," or "I wish that I could figure out something." The problem-solving part of the conversation may have started. As we continue to use the wise adult with the new adult concept, it is important to continue showing that we respect and trust the student as an emerging adult. At this point, you could ask if it's a good time to start looking at things that could help them feel better. You will know if this is too early if you start brainstorming or attempt to highlight a promising choice of something they could try, and they don't contribute, or they say no, or yes, but to all suggestions. How can we reinforce independence while introducing brainstorming? Most people value and follow a plan more if they have created it. You as a wise adult can encourage this by helping the student to come up with ways they can feel better. Encourage them to describe things that they enjoy doing at home. How could they recreate those types of activities at College of Charleston? As an example, if they've always played soccer or basketball or baseball, could they participate in club sports? Has your child had difficult times in the past? Encourage them to think about what specifically helped and apply it to what they could do at College of Charleston. Maybe they have moved in their childhood. What did they do while trying to develop those closer bonds of friendship? Sometimes it is important to offer suggestions because you may have more knowledge about the available resources at College of Charleston than your student, or you may be more adept at looking for them or reaching out to others for help. Ask permission to offer these suggestions. Can I suggest some things to consider? This is where you can introduce resources like Cougar Connect, volunteering opportunities, connecting with students for support, going to the counseling center, reaching out to RAs. Even if you have a good conversation about homesickness, it may come up again, and probably will. Maybe specifically about homesickness, but it could be about midterm stress or roommate problems. But you'll just repeat the steps. You'll listen, giving them time to explore the topic, validate them while listening to them, and then if it moves to problem solving, help facilitate them finding solutions. For a small percentage, homesickness will be a larger problem than the normal process of transition. This is where listening and contact with you is so important. You, as the parents, are the people who know your student best. You will be able to tell if there is significant changes. Here are a few things to look out for. Here are some general indications of needing help. In general, large negative changes combined with those changes affecting the different areas of the student's life is a concern. We look for negative changes in appearance and mood. We look for isolating from others, increases in risky behaviors, or increases in hopelessness and helplessness. More specifically, the assumption that a student is just homesick may mask something more serious, like depression or anxiety. If a student is depressed, then they would often express feeling sad, unhappy, frustrated, or numb for the majority of the day for multiple weeks. They may indicate that things they used to enjoy or love just isn't interesting to them when they try. Depressed people can be indecisive, distracted, and have impaired concentration. They often feel worthless and focus on blaming themselves for perceived failures. They could have noticeably slowed thinking, speaking, or body movements. In some cases, they can have thoughts of dying and suicide. If anyone mentions suicide, immediate assessment should happen. Research tells us that very few people are saying this for attention, and regardless, even if it is said for attention, they need appropriate attention. Anxiety can also be something confused with homesickness. In fact, anxiety and depression can go hand in hand. Anxiety differs in that it is near constant worry. It can be avoidance of social situations because of fears of being judged, humiliated, or rejected. It could be having panic attacks seemingly out of the blue, and this is important. The person is spending a lot of time worrying about having another one. In all of these cases, the symptoms make it difficult to function. The student may not be able to go to class, be unable to initiate conversations to make friends. They may be unable to be with friends, go to the dining hall, go exercise, attend club meetings, or more. If your students' feelings, emotions, and reactions are interfering with their ability to access and use the different aspects of college life, then it would be important for them to be assessed by the Counseling Center. The College of Charleston has a counseling center, counseling.cofc.edu. The professional counselors use solution-focused, short-term, goal-directed therapy. Due to current events, appointments are virtual. Students can also request appointments online. We also offer TOW, available through our website. It is a self-paced, interactive program available 24 hours a day, 7 days a week for students. It focuses on challenges facing students like interpersonal relationships, sadness, and stress and anxiety. Students can also use students for support. These are trained and certified student volunteers available to text or talk through issues that face college students. They are available Monday through Thursday, 12 to 9 p.m. through texting for support to 839-863. They have been available in person in the past, but due to current events, we are unclear on what that will look like this semester. If you are concerned that your student is showing signs of something more serious than homesickness, and they are unwilling to go to the counseling center or other resources that you have presented to them, then we encourage you to reach out to the Dean of Students office. The Dean of Students provides help to students who are having personal, academic, or financial problems that will prevent them from succeeding at school. You can go to their website, deanofstudents.cofc.edu, to learn about the FAST form, where you can assist students by sharing a concern with the Dean of Students and what happens when that form is submitted.